Merci à vous de m'accueillir et de m'avoir invité pour faire part de...
Thank you very much for inviting me here today to share my experience as a pharmacist, one trained in TPE, but also as a patient. And sorry for the English speakers, I will be speaking in French, but unfortunately my English is quite horrific. I wouldn't be at all comfortable speaking in English. I would just like to say that the Dr. Alexandre Piauget could not be here today, but we prepared this presentation together. We prepared this presentation together, and I really hope that I will be able to reflect all of the joint work that we did in my today's presentation. So when we have patients come into the pharmacist, either after they've been with a dermatologist, hopefully a well-trained specialist, we have to then ask the patient what was said during the consult, what they already do at home to treat their AD, so that when we're speaking with them, it is pertinent. And sometimes we need to reword some information that they've already heard, but isn't fully appreciated. Sometimes it's good to talk over basic hygiene, which maybe is a topic that they weren't able to cover during the short consult. And it's also a way of reiterating what was said during the consult, to avoid not giving mixed messages, to not feeding into corticosteroid phobia, because while the doctor may have worked fantastically against it, we may accidentally feed into that phobia. So we really need to listen to the patient and reassure them. Remember, we are the last healthcare professional that the patient will see before being left up to their own devices to deal with their own management. And as we saw, if we have a bad attitude, if we don't have the right behavior, then that will have a negative impact on the patient. So what does TPE bring? Well, we saw that what it means for a doctor, but in the pharmacy we're not talking about educational therapy. We're talking about an educational attitude. So TPE training for us means that we can be there to provide information, to therefore optimize the patient outcomes. So it's a way of communicating with patients so that the patient will truly adhere to their treatment plan. If you have attended a POP training session as well, then it's fantastic because you've got best practices that come out from learned circles and are constantly updated, so they're fantastic resources. I would like to talk to you about my own personal journey. My primary training as a pharmacist, I'd like to tell you that during that training, we didn't speak about AD, which means that for some 45 years, it was hard to ensure that patients would adhere to any treatments that would come through because I just wasn't trained properly in it. But for me, it comes more from a personal journey. And what my personal journey has helped me in dealing with patients coming through my pharmacy. When I told my friends that I was going to Malta for a congress, they said, hopefully you'll be able to get to St. John's Cathedral, because in the cathedral there's a fantastic painting by Caravaggio. Hopefully you'll get to see it. And, that's all theory. Yesterday, we all went on the visit, and after the visit, we're all struck with an emotion. Some people were deeply moved, but that's because it's their own journey. Me, or for those who aren't necessarily interested in Baroque art, they had a different experience of the visit. And in knowing one's journey, it's a bit the same. I have a lot of theoretical knowledge of the patient journey, but I also have my own personal experience of that journey. And because of that personal experience, I have a different sensitivity, which is probably more relevant to what patients are living. And yet we all know that everyone's personal journey is different. So not everything is the same as what you have lived. Each patient is different, and therefore we have to allow patients to bring forward their own journey, their own story, rather than superseding that with our own. In my own experience, I would say that some communication is easy. Empathy could be more present, but also as a patient, but as a pharmacist, when speaking with a patient, I feel that having lived it myself, I have more credibility. We have all seen how important it is with patients and expert patients. Now, I'm not an expert patient, because when a patient comes to see me, they are in front of a healthcare professional. And I don't play the same role as expert patients. And yet, the fact that I am myself a patient means that the patients who come to see me will feel like there's a greater chance that I will understand them. And I feel we'll be much more effective in reassuring patients. For example, a young mum or young parent with a child affected by atopic dermatitis, and that they may feel more comfortable because, unfortunately, they see a lot in media or on Google. There's a lot of negative messaging about it. And the fact that I myself am a patient may help me have a greater impact in reassuring that young parent. As a pharmacist, we see AD patients far more often than dermatologists, but also more than the pediatrician or the GP. And we see a lot of patients coming in because when they come into our pharmacies, it's because our doors are wide open. They don't need to take an appointment. So people tend to come in much more freely. And it's our opportunity there to detect much more easily than doctors a patient who will start to no longer take their medication, who will be fed up with it, and who will be on the brink of putting an end to the treatment outright. So in the pharmacy, we can detect those patients much more earlier on. And it's like when you have a diabetic patient putting an end to insulin treatment, then their life expectancy is going to be drastically dropped, and they will be likely fall into a hyperglycemic coma and be sent to the hospital straight away. So it's a much more immediate effect. However, with atopic dermatitis, when you stop treatment, your life isn't in danger. Yet all here in this room today, we know that it will have a fundamental impact on one's quality of life. So as patient, but also professional, I'm quite privileged in that I have a great power to be able to reassure these patients, to encourage them, and to say, yes, it is worth your while to continue treatment. It is a way of boosting motivation. And another fundamental role that we play is that we are the last healthcare professional to have a contact with the patient before they head home. But sometimes we're also the first healthcare professional to have contact with these patients. So think about those patients who are no longer part of the healthcare system, who who no longer have medical treatment, simply because they are in an area where there is not enough medical care available. So these patients, they come in, and therefore we need to be both a professional and a patient to listen to them. Now, through the COVID period, France, like many other countries, was put into lockdown or travel bans. And obviously, pharmacies were some of the only places that remained open. And I had patients come in to my pharmacy I'd never seen before, even though I'm in a village where I know most people. And I remember there was this one girl who had been completely disfigured because of her eczema. Her eczema was really causing her great suffering. It was probably aggravated by the challenging times that we're all going through. And she came in asking for a cream because she left it back at home and she didn't have her regular cream with her. And I let her speak. And then I asked her, would you like to treat this? And she said, yeah, but I am already treating it. I put cream on, everything's fine. And I tried to get her to realize that, no, it wasn't good. What she was living was not normal. And that is where we have to really understand that what is normal for a patient is not necessarily what's normal for a professional. So sometimes what we see, it's completely unimaginable. And this patient came back a month later. I hadn't seen her in the meantime. She came back, and I recognized it because I am fantastic with recognizing faces, but her face had completely changed because her skin was healthy, and she came back to thank me. She thanked me because I brought her back on track in dealing with her own health.
So this was just my experience. But again, as a patient, I think this is an extra resource. This is also an opportunity because we can talk from experience, and it may help our patients. And I hope that, being a patient myself, I hope that I can also have a positive influence of my patients. So thank you very much for your attention.